Next up, Payton Rule. So Payton has been part of our community forever. She was a camper. She is the St. Louis branch leader. And now she is getting I'm going to let her tell you about herself. But she is a graduate student and is going to share a study results with us. So really interesting discussion with Payton Rule. Thanks, Payton.
Hi, I'm Payton. I'm a clinical psychology PhD student at Washington University in St. Louis, and my research broadly focuses on the question of how do we help promote mental health and well-being for people with rare diseases or different disabilities. And so today, I'm really excited to share with you some results from a study that my team and I conducted looking at ways of cultivating emotional well-being for people with CMT. And in addition to being a PhD student and a researcher, I'm also a proud member of the CMT community. I was diagnosed with CMT when I was 5. And that picture was actually taken from the first CMTA conference that I ever attended when I was 13. And, I'll be honest with you, at that age, I really wasn't sure if it was possible to live a good life with CMT. I had a lot of anxiety about what my life was going to look like in the future. Would I be able to do the activities that I love to do? Would my CMT progress? Would I be happy with my life? And, I think a lot of people in this community maybe share my fears and struggle sometimes with their mental health and their well-being. But I've also met a lot of people in this community who, have pretty significant physical limitations related to their CMT, but still have really high well-being and mental health. And so that led me to wonder if physical limitations alone are not the only thing that are impacting our emotional well-being, what else is? And so naturally, as a researcher, I went to Google to try to figure this out and was very disappointed to learn that there really isn't much research out there about, how we can help promote mental health and well-being for people with CMT, besides the very important research on how to increase our physical mobility and, functionality. Fortunately, in other diseases, there has been some research to suggest that psychological and social factors can actually have a big impact on our mental health and our well-being. And so I wanted to see, is this also true for people with CMT? So in that other research, they found that factors like self-efficacy, so how much confidence you feel like you have in your ability to deal with challenges related to your CMT, the amount of social support that you feel like you have from your loved ones, the amount of social support you feel like you have from the CMT community, how much anxiety you have related to your CMT. I know I, for one, have worried a lot in the past about tripping and falling or not being able to keep up with other people or CMT progression. And lastly, sense of purpose. So this feeling that you're really directed in life and that you're engaged in valued activities. All of these things in prior research and other disabilities have been shown to impact well-being. And one thing that really excites me about these factors specifically is that they're all modifiable. Research has shown that we can actually change these factors. So if you have low self-efficacy, for example, research has shown that we can kind of cultivate or increase that. And the same goes for these other factors as well. So I really wanted to know, could these factors potentially help to promote well-being for us CMTers? And so we conducted a study, my team and I want to apologize in advance. I'm a researcher. So I'm going to go through some potentially more boring logistics of the study here for just a minute. But I hope that I can, wrap this up and make it worthwhile in the end. So just stick with me. So for this study, we recruited about 260 US adults with CMT. And we actually did this through a collaboration with the CMTA. So huge thank you to them. We would not have been able to do this study without their help. And many of you may have also participated in this study. So if that was you, my team and I are so appreciative, and this research would not be possible without you either. A little bit about our sample demographics. We had about an even split of males and females, and the majority of our sample was white. And so how did we study this? Well, we asked those 260 participants with CMT to complete an online survey where we asked them about their well-being. We asked them, are you satisfied with your life? How do you feel like your quality of life is? And we also asked them about those psychological and social factors that I mentioned earlier, the self-efficacy, social support, CMT-related anxiety, as well as sense of purpose. So what did we find from this? Well, the first thing we wanted to know was, could those psychological and social factors that I mentioned potentially, be related to well-being, potentially help to promote well-being? And we found, first of all, that individuals with higher self-efficacy also tend to have higher well-being. We also see this with social support. So individuals who feel like they're more supported by their loved ones also tend to have higher well-being. Individuals who feel more supported by the CMT community tend to have higher well-being. Individuals who have more anxiety related to their CMT, they tended to actually have lower well-being. And individuals who felt like they had kind of a greater sense of direction in life also had higher well-being. And, these results are not necessarily surprising. They're pretty intuitive. But I think one thing that was really interesting that we learned from this study is that there's one of these factors kind of emerged from our data as being particularly powerful for promoting well-being for people with CMT, and that was sense of purpose. And so I mentioned before that on its own, sense of purpose is a really powerful promoter of well-being for people with CMT. But in addition to being a powerful promoter on its own, it also helps to enhance and protect well-being. And it does this by kind of boosting the positive effects that we see from those other psychological and social factors that I mentioned earlier. And so I think this can get a little bit complicated or muddy. So I want to take a step back real fast and look at this concept in kind of a non-psychological example. So imagine that you have a tree, and there are a lot of things that you can do to help promote this tree's well-being, right? You can water this tree, you can prune the tree, you could give this tree extra nutrients, and all of these things are really going to help to increase the well-being of that tree. And so we can think of these things as kind of equivalent to the psychological and social factors that I mentioned earlier that also help to promote well-being. So those would be things like self-efficacy, social support from loved ones, and social support from the CMT community. But inevitably, this tree is also going to weather some storms, sometimes maybe literally. And this weather might have a negative effect on that tree's well-being. It might, damage the roots or break that tree. And so we can think of this as kind of similar to that CMT-related anxiety, something that is kind of harmful for our well-being. Now, this tree might be able to thrive in this system, right, with only these factors. But what would happen if we added a little bit of sunlight? Well, that sunlight might actually help to boost all of those positive things that we've already done for that tree. So, for example, that sunlight might help that tree to absorb even more of that water, or to absorb even more of those nutrients that we gave it, or to capitalize on the benefits of that pruning. And also, while that, stormy weather might be, harmful for that tree, that sunlight could potentially help to strengthen that tree's roots so that it's less vulnerable to the damage that that storm might bring. And we can think of the sun as similar to sense of purpose. And so just as a reminder, we found I said earlier, that individuals who have high self-efficacy tend to have higher well-being. But if that person also has a high sense of purpose, that person will have even higher well-being. So it's boosting that effect. And we see the same thing for perceived social support. Individuals who feel more supported by their loved ones have higher well-being. But if they also have high sense of purpose, their well-being is going to be even higher. And lastly, we see this with the CMT community support, that individuals who feel really supported by the CMT community and have a high sense of purpose have even higher well-being. Likewise, you might remember that I mentioned before that CMT-related anxiety is kind of harmful for our well-being, or it can be. And so just like, that sunlight was helping to protect that tree or make it more resilient to that storm, sense of purpose kind of does the same thing here with our anxiety. So even if an individual has high CMT-related anxiety, if that person also has a high sense of purpose, their well-being is going to be less negatively impacted by that anxiety. And so, sense of purpose seems to be a powerful promoter for well-being. So all we have to do is just increase our sense of purpose, like easy, right? I think a lot of people, when I talk to them about sense of purpose, they kind of wonder, what can we do to even increase it? Can it be increased? And I think the good news is that all of the research has suggested that we can increase our sense of purpose. And there are a lot of different ways to go about that. But my lab and I have been working on a couple different activities aimed at helping people increase their sense of purpose. So I figured I would just walk through this activity using myself as an example, just so you can see kind of how it's done and maybe get you thinking about how you would complete this activity. And if you're interested, you're more than welcome to complete this activity on your own time. So like I said before, sense of purpose is really characterized by feeling really a sense of direction in life and feeling like you're engaged in activities that you really value. And so the first thing that we ask people to do for this activity is to identify what your values are, 1 to 2 values. So for me, I really value compassion, and I also really value health and fitness. And so the next thing that we have people do is to identify 1 to 2 activities that may align with these values. So for me, maybe I could volunteer to align with my value of compassion. Or maybe I could find a physical activity that brings me a lot of joy that might align with my value of, health and fitness. The next thing that we ask people to do is to identify barriers that might prevent you from engaging in those activities. And I think for us CMTers, there could be some added barriers here, right? For me, the things that I thought about were inaccessibility. Maybe that site that I've always wanted to volunteer at isn't quite physically accessible for me. Or maybe my muscle weakness from my CMT prevents me from engaging in the physical activity that I, wanted to try. Or maybe I just have a lot of anxiety about engaging in those activities. And so the last thing that we have people do, which is maybe the hardest, is to brainstorm potential ways around these barriers. So this could look like, assistive technology, using assistive technology to engage in the physical activities that you want to, or, asking for accommodations for that volunteering position, or seeking assistance and support from a mental health provider to better cope with my anxiety. So I know that I, just threw a lot at you. And so I just wanted to kind of wrap up here by talking about the things that make me so excited about this research, or the main takeaways that I took away from this research. And I think the number one thing that I took away was, we now have data to support that it is actually possible to have high well-being with CMT. And I think back to myself, a 13-year-old self at my first CMTA conference, and how I really wasn't sure about that, and how there wasn't really a whole lot of data out there for me to look to. And we can now see from this data that, even individuals who have, a high level of physical limitations, a lot of them still maintain really high well-being. And I'm not saying, toxic positivity here by any means. We absolutely face a lot of additional challenges, ableism and accessibility, just to name a few. But I do think it's really cool to see that while we don't have a cure for CMT, it is possible to live well with CMT now. And one way to potentially do this is through psychological and social factors. These seem like really powerful tools for helping to promote our well-being and our mental health. And so being really intentional about, finding that support, or, getting more involved in the CMT community, like you guys all are, could be really helpful for helping us to maintain our mental health and our well-being. And third, I know this one might seem obvious, but taking care of our mental health is really important as people with CMT. And, I think for me growing up, a lot of emphasis was placed on my physical functioning, right? I think we go to a lot of doctors, neurologists, PTs, OTs, orthotists, the list goes on, who are so invaluable and so important. But the emphasis is always on physical health. And so I think sometimes, at least for me, my mental health just slipped through the cracks. And so I think, finding ways to be intentional, seeking out support, whether it's from loved ones or from a professional, can really make a huge difference for us and just our experience of living in the world with CMT. So I just want to thank all of our study participants. If that was you, huge thank you. Could not have done that study without you. Also want to thank the CMTA for their generous support for our recruitment, as well as just for inviting me out to talk here today, as well as, the PACE initiative, which is my funding for this conference, as well as my amazing research mentors and collaborators at Washington University. And if we have time, I am happy to take any questions.
Any questions? Oh, I see a hand. Yes, Sarah Cater, online, Zoom.
We have someone asking if your study has been published yet and where they can access it.
So yes, it has been published. It is in the Rehabilitation Psychology Journal. One thing that kind of sucks about academia is that it is not super accessible to the general public. So you're more than welcome to try to search for the article. You may be able to access a part of it. But one of the reasons that I was really excited to give this talk is because I think the people who are doing this research about deserve to get those results back. It's because of you that we were able to do this study. And so that's a really long about answer of saying there's no great way to actually access the published paper unless you have unless you're at a university and you have a university email and they subscribe to that journal. However, if any of you are interested in it, feel free to email me and I can kind of try to facilitate that and get you the findings.
Great question. And one in the back, Sarah Gentry, do you still have the mic?
Yes.
Right back there. Thank you.
Hi, thanks for a great talk. So my husband, Chris, has CMT, and I'm here as his wife, but also as an MD. And so coming from a Finnish European perspective, Finland is a nation with 5 million people, so CMT obviously is not something that's at the forefront of even neurologist minds necessarily. And something that we've struggled in particular is access to care. So my husband, who'd be really willing to have AFOs, was told at his last assessment that he doesn't need them because he can still walk. So, which is completely absurd. I'm just wondering if access to care was something that would have been something that the study participants would have mentioned as being something that would negatively impact on their mental health, welfare and well-being.
Yeah, that's a great question. So I didn't talk about these results, but at the end of this survey, we actually asked people an open-ended question of, is there anything that we haven't asked about in this survey that you feel like is really impacting your mental health positively or negatively? And one of the main themes that we found from that was difficulty finding knowledgeable medical professionals. So absolutely, that's a huge thing. Like you guys are not alone in that at all. That was popular enough in our responses that it made it into like the top, I want to say like 3 or 4 themes that we found from that paper. Yeah, it's a huge issue. I have found the CMTA database to be really helpful in trying to find providers that are knowledgeable about CMT, but it's a problem. Like, yeah, absolutely.
Great question. Okay. Payton, wonderful job. Thank you.